Ashley McCray for BMA Cable Networks. Thank you for joining us for this COVID-19 news update. Minnesota Governor Tim Walz announced he is self-quarantining for a period of 14 days after learning he had contact with an individual who tested positive for COVID-19. In a statement, Governor Walz said, quote, "I'm using this as an opportunity to lead by example. Though I'm feeling healthy and not showing any symptoms, I'm going to work from home and model the protocol we are asking all Minnesotans to follow." Also in the news, Governor Walz and members of his COVID-19 executive team have put into place executive orders to suspend evictions, support small businesses, and address hospital equipment shortages to further strengthen Minnesota's response to this COVID-19 pandemic. Governor Walz and Lieutenant Governor Peggy Flanagan also released a revised supplemental budget directing an additional $356 million toward COVID-19 response. The revised budget will provide emergency grants to child care centers, support families struggling financially through the Minnesota Family Investment Program, veterans and their families facing financial burdens, increase funding for food shelves, offer small business loans, and increase resources for Minnesotans struggling with homelessness. The budget would also create a COVID-19 Minnesota Fund, allowing the state government to deploy resources and respond to the needs of Minnesotans in real time. In addition, the governor extended Minnesota's tax filing deadline to July 15th to align with the federal government. For underinsured, Governor Walz and MNsure announced a 30-day special enrollment period for qualified individuals who are currently without insurance as a result of the growth of COVID-19 cases. The window opened on March 23rd and runs through April 21st. Uninsured individuals have 30 days to enroll through MNsure.org. States across our country are issuing shelter-in-place orders. In Minnesota, Governor Walz issued a stay-at-home order for Minnesotans to help slow the spread of COVID-19. Modeling released by the Minnesota Department of Health and University of Minnesota predicts that more than 70,000 Minnesotans could die from the novel coronavirus if we take no action. The governor is directing Minnesotans to stay at home and limit movements outside of their home beside essential needs. This order goes into effect at 11:59 p.m. on Friday, March 27th, and ends at 5 p.m. on Friday, April 10th. During this time, you can still go to the grocery store, medical appointments, and the pharmacy, get takeout, delivery, or drive-through from a nearby restaurant. Be in nature, meaning you can still take walks, walk your dog, ride your bike, those sorts of things. You may also leave your home to pick up essentials for neighbors or loved ones in need of assistance. Workers who provide critical services during this time are exempt from the stay-at-home order. This includes, but is not limited to, healthcare and public health, pharmacy, law enforcement, public safety and first responders, childcare, homeless shelters, food and agriculture, news media, energy, water and wastewater, and critical manufacturing. According to USA Today, China is no longer the global leader in the cases of this virus that originated on its soil. The U.S. has surpassed China and Italy in confirmed coronavirus cases. As of this broadcast, the number of worldwide positive coronavirus cases stands at 532,224. Of those people, 124,326 are recovering, and more than 24,000 have died. The United States reports 85,594 positive cases. More than 1,800 people are recovering, and 1,300 deaths. Here are some important reminders from the Centers for Disease Control and Prevention to help stop the spread of coronavirus. I'm sure you've seen these before, but due to these circumstances and current situation, they are definitely worth a reminder. Number 1, wash your hands often with soap and water for at least 20 seconds. Number 2, avoid touching your eyes, nose, and mouth with unwashed hands. Number 3, please stay home if you are sick. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Number 5, clean and disinfect frequently touched surfaces daily. This has been a BMA Cable Network's COVID-19 news update. Thank you so much for joining us.